Hi friends, I am Dr. Pratap Sinator. I have done MD in Poison Medicine. In today's video, we will discuss about poisoning from oxalic acid. Oxalic acid, which is also known as acid of sugar or salt of sugar, occurs in the form of colorless, transparent, and prismatic crystals. In the form of oxalates, it exists as a natural constituent of many plants like spinach, rhubarb, cabbage, etc. Coming to uses of oxalic acid, it is used as a bleach to remove stains or to clean brass, copper articles, or leather. It is also used in calico printing and to remove writings from many documents and to do signature illegally. Coming to actions, crystals of acid and concentrated solution of more than 10% of oxalates are corrosive in action. They rarely damage the skin but rarely corrode the mucous membranes of digestive tract. So skin damage is less but mucous membrane damage will be more. If there is a less than 10% solution, it acts as a strong irritant but causes serious systemic effects when it is observed even though the concentration is less than 10%. Coming to systemic action, in large doses it causes rapid death from shock. It can cause hypercalcemia because it readily combines with calcium ions in the body tissues and causes withdrawal from them. It causes renal damage because oxalates produce tubular nephrosis and necrosis causes death from uremia in 2 to 14 days. Even after absorption, urinary excretion persists for up to 24 hours. Fetal dose of oxalic acid is between 30 grams and fetal period within 1 to 2 hours, the person will die. Coming to signs and symptoms, coming to fulminary poisoning, that is when it is taken large amount of that is about 15 grams or more, it produces immediate death by symptoms within minutes. There is burning, sore, bitter taste from mouth to stomach. The person experiences burning sensations. Pain is very severe, begins in the epigastrium and it may radiate to up to stomach. There is nausea and irritations, which may followed by vomiting. Usually contains altered blood and mucus and has a coffee ground appearance, typical of oxalic acid. In life, if life is prolonged, diarrhea occurs, and that usually occurs before even the bowels are affected if the purpose concentration is more. Acute poisoning, when it is taken occurs in large dose, but not so much in causes fulminary poisoning. When the patient survives for few hours, it is characterized by symptoms of hypercalcemia. So symptoms of hypercalcemia will be present like muscle irritability, tenderness, tetany, or convulsions. There may be numbness and tingling of fingertips and legs. Usually signs of cardiovascular collapse also occurs because of hypercalcemia. In some patients, there may be stupor and coma. In case of delayed poisoning, it is characterized by symptoms of uremia, that is kidney damage will be more. The urine may be scanty or suppressed and may contain traces of blood, albumin, and calcium oxalate crystals. There may be metallic acidosis and ventricular fibrillation also combined with that. Coming to treatment, stomach wash is done using calcium lactate or calcium gluconate with 2 spoonfuls in each lavage. Antidote for oxalate poisoning is mainly in preparation of calcium, which converts the poison into insoluble calcium oxalates, which can be easily excreted, like lime water, calcium lactate, calcium gluconate, calcium chloride is all, or suspension of chalk in water or milk can also be used for removal of oxalic acid. Usually, calcium gluconate 10% of 10 ml IV at frequent intervals is given to remove the oxalic acid. Dialysis or exchange transfusion for renal failure is done. Pyathora extended 100 units IM in severe cases to counteract hypercalcemia. Demonstrate rings to prevent absorption. Bowel may be evacuated by enema or by castor oil to remove any remaining oxalic acid. Then symptomatic treatment is given. Coming to postmortem appearance, burns of the face and skins are rare. Sensitive corrosion is very less, even at 10% concentration. If the poison has been used in strong solutions, the mucous membrane of the tongue, mouth, pharynx, and esophagus will be whitened, has a bleached and has a scalded appearance, but it's sometimes reddened by irritation. The inner surface of esophagus is corrugated and shows longitudinal erosions. The mucous membrane of stomach is reddened or punctured from erosions or almost black, but perforations is very rare. Since it doesn't has a corrosive action, it causes reddening, erosions, but it doesn't cause perforation. Numerous dark brown or black streaks runs along the length of the stomach or the mucous membrane, often with intercommunicating branches. The stomach contains gelatinous or brownish due to acid hematin formation. The intestine usually escape, but upper part of duodenum may be affected. The kidneys are swollen, edematous, congested, and filled with oxalic crystals. The renal tubules are necrosed, primarily in proximal columnar tubules. If the effects are only narcotic, there will be congestion of lungs, liver, kidneys, and brains without any local appearance. So, to testing oxalic acid, a solution of barium nitrate will gives a white precipitate of barium oxalate, which is soluble in hydrochloric acid and nitric acid. Usually, oxalic acid is accidental poisoning due to being mistaken for magnesium sulfate or sodium bicarbonate crystals. Suicidal poisoning is rare. Homicide poisoning is rare due to sore acrid taste. Rare it is used to procure abortion by vaginal injection. These are my references. Thank you.